Professor Cheryl Thompson, and I teach community health nursing and oversee our nurse managed centers where students in the senior level community health nursing course have their clinical experience. And we found that in our nurse managed centers, students are able to have a wonderful clinical experience while we are also able to provide health services to individuals who are low income. Our primary mission is to provide a clinical experience that is appropriate to the course objectives. Our secondary mission, of course, is to provide high quality health services to the residents that we serve. The patients that we take care of are able to get kind of a unique opportunity to work with the same provider, meaning the same student, every week for an entire semester, and that has really improved the experience for the students because they can see the difference that a long-term relationship makes in being able to plan and carry out interventions.
The presence of the two nurses, Tom and Carla, have been a great value to us. They make us hope that there is a lot to be enjoyed by their visit. They advise us on what we can do to improve. Myself in particular, about my present state, that is diabetic. And they have also advised my wife, who is a stroke victim for years now. The advice to her too have been of great value. We do appreciate the nurses.
I think just us being here is, confident to them that they know that they can trust us.
I always tell our students they're really lucky to be York College students and to have this clinical, because not many nursing programs take on this kind of endeavor because it is a big commitment. You can't go in and provide services like this during the regular semester and then close when the college isn't in session, because you're seeing people, many of the patients that we see every week, and that weekly monitoring is important for them so that they don't have a worsening of their condition.
She found me when I was dying. I might as well say my blood pressure had dropped to 20. And she kept coming in to see how I was. And they were downstairs to a party. She still was thinking about me, so she came up and brought me a cupcake. And I was laying down. So then she left and went back down to the party. After she came back up to the party, she seen that I wasn't talking. And then she called the ambulance for me. She went down and got Pearl, the other nurse, the head nurse, and told her that she didn't like the way I was looking. And her and the other nurse came up, and that's what saved my life.
She was the first patient I had at the Delphi House, and I was very pleased to come up and see her. On a daily basis, things I would do for her, I would take her blood pressure, do a physical assessment, help her with her medications and make sure she stayed on top of those. I would fill out her calendar for her to remind her of her daily doctor's appointments and things that Rabbit Transit they need to supply ahead of time, so she would need to call like a couple days in advance to get that prepared for her. Also just sit and talk and got to know her really well, and she's become a very important part of my life, and I love the time I get to spend with her, and it's very precious to me. And also other things that I have helped her do is reach out to the community and help her get services for cleaning, and we're trying to get her into Senior Life, a program that is offered throughout York County. And it takes a lot to get through that, and there's a lot of paperwork and stuff, so having us here helps them. And it's not only helping them, it's fun for us to become involved in their lives. And she also has, when I came in January, she has foot health problems that were deteriorating, and with our help and our assessments, we have helped gotten her through those, and keeping her on top of those with her doctor's appointments.
When students begin the clinical, they're not really sure what to expect. They don't understand what a nurse managed center is. But then we find after the 14 weeks that they've been here, their impression is more that they may never practice in this kind of setting, but the experience has changed how they will see patients in the hospital or in the emergency room, and help them discover that if you discharge somebody and teach them these are the medications you should take and you should follow a low salt diet, that what that means for them in the way they grew up is very different for somebody who lives in poverty. So I think that we're contributing to making better nurses as a whole in our healthcare system, because we're giving them the opportunity to really see what low-income challenges are for individuals who are trying to manage complex health problems.
I guess if they weren't here, I wouldn't be here.
The nurses are smart. They are indeed asset to the government and to fellow individuals. They make us feel hopeful.